Thank you to our sponsors, K. Flynn Insurance, elect Bruce Becker for the Lincoln County Fire Board, and the Crafty Midwestern Mommy for their continued support of the Lincoln County podcast.
I am Julie Forster with Crafty Midwestern Mommy, your local boutique embroidery and fabric store. I sell fabric as well as sewing notions and also teach classes. And then we also, on the other side of our business, do machine embroidery, custom apparel for local businesses, and just personalized gifts. Again, the store's name is Crafty Midwestern Mommy, and that's how you can find us on all social media platforms as well as our website.
Hey guys, welcome to Lincoln County Podcast. Thank you for checking it out today. I'm really excited for our guests. I think you're going to get a lot of information out of today's episode and learn a lot about a business in Lincoln County and in Troy specifically that you may not know about. So make sure you like it, share it, subscribe. Check out our sponsors. Without them, none of this would be possible. So we are very thankful for them and their support as they keep us doing what we're doing here today. So I'm going to turn it over to my guest to introduce himself, and we're going to kick this off. So how are you doing today?
Hi, Matt. It's a pleasure to be here. Thank you for this opportunity,
Thank you.
and it's definitely a pleasure. My name is Dr. Paul Hannam, and I own House of Health here in Troy, Missouri. It's been open since June of 2023, so last year, and it's a direct primary care practice. And what that means is essentially we don't take insurance, and we deal directly with our patients, and I find that increases patient satisfaction and physician quality of life. And, I'm a dad of three. Of course, I'm crazy about my boys, and right now I have them in soccer, and so I coach soccer, and,
Nice.
So it's just one of those things. I definitely love being a dad. I think it's definitely one of the things that I set out to do when I was a kid.
Awesome.
Was
That's cool.
to be a
Hey,
dad, of
that's
course.
good. A lot of the male population doesn't do that. So that's awesome that you did.
Yeah. Oh, yeah. Enjoy it. And, my journey here to Lincoln County has definitely been a circuitous one. I'm originally from Jamaica.
Okay.
So I was born in Jamaica, and I moved here in 1998. Soon after 1999, I joined the U.S. Navy.
Oh, awesome.
Yeah, so I was active
Thank
duty
you for your
Navy
service.
appreciate your support. I was active duty U.S. Navy for about 5 years, got out of active duty, and started my degree at High Point University in North Carolina.
Okay.
Of course, college life was great. I got my bachelor's in biology, and from there I taught high school for 2 years. Enjoyed teaching, but I quickly realized that, teaching high school wasn't for me.
Yeah.
And so between leaving college and finishing teaching high school, I was able to get into med school at Meharry Medical College, which is a medical school in Nashville, Tennessee.
Oh, awesome.
Yeah.
Nashville's beautiful.
Isn't it, though? It's a great town. From Nashville, I went to South Bend, Indiana, where I started my residency in family medicine. And from South Bend, settled in Carmel, Indiana for a little bit. And then from Carmel, Indiana, I found a physician who was practicing the direct primary care model in Cassville, Missouri, which is tiny town in the southwest corner
Yes, I haven't
of
even
Missouri.
Heard of that. Yeah,
That's right.
okay. Yeah, that's probably what everybody says.
Right, exactly. If you've heard of Roaring River State Park, then you've passed through Cassville to get there. Either way, went to Cassville, and I practiced with her for 4 years. And I really learned a lot about direct primary care and what it means to patients and what it means to the physician. And it's really just a radical way of treating patients that ignores the insurance side of things and focus directly on the patients. And that's just been a beauty, not just for me as a physician, because I actually see that this is the way I want to treat my patients, but more so for the patients, because when they come in, they're the boss, not the insurance company. They tell me, what we're going to pay for, what we're going to do based on my medical knowledge, of course. And then we go from there. And we don't have to think about, well, what's the insurance going to pay for? Or what's going to happen here? What's going to happen there? And so I found that direct primary care was definitely the way I wanted to practice medicine.
That's awesome. And I think that's the biggest thing is, like we talked beforehand, it's kind of that old school model of the local town doctor that takes care of everybody in the town and takes care of their needs. It's not that you're at this medical building because person A has such and such coverage, so they have to go to this one. And there's not that cutoff of that personal care.
Right. And you are absolutely right. What insurance has done it's made navigating healthcare in this country arduous. Meaning, you know, if you have, as you said, A, insurance, you may not be able to see this physician over here, but you have to go see that physician. But what if this has always been your physician? What if he's the one that delivered your 2 kids and was your mom's doctor? Now all of a sudden you can't see the doctor you've known all your life. You have to go see another physician. And that's the first part of it. Second part of it, we know that insurance companies are involved in many stall tactics. They delay paying for your care, even when it's, you know, the treatment may be obviously indicated, especially if your physician thinks so. And that's well documented, where insurance companies are stalling to delay paying for their patients' care. And all of this adds up, and it forces patients to be very frustrated with the system. And enter direct primary care, you're talking directly to your physician. My patients have access to me, whether it's 6 p.m. at night or, you know, 8:30 in the morning. Why? Because I don't want my patients to have to go to urgent care. I don't want my patients to have to go to the ER unless they absolutely have to. That saves them time. It saves them money.
Yes.
Another thing that you'll find, Matt, is I keep many of the common medicines that I prescribe in my clinic. And what that means, instead of you having to go to Walmart, wait 30 minutes for your meds, most times, if it's that antibiotic or that albuterol, I have it right there. Here you go. And so you've just saved 30 minutes going to Walmart and waiting for them to fill your prescription.
Probably more than 30 minutes.
Well,
probably more than 30.
Probably,
yeah, for
sure.
sure.
Yeah, so love it.
That's great. And I think not all areas might be open to that. I think Lincoln County is an area that will fall in love with this as the word fully spreads on what it is. I think that's probably maybe one of your biggest hurdles is just educating people on what it is. Because I mean, I didn't know when you first were at some of the different groups and things, I didn't know what it was. You know, oh, it's a doctor, they have an office, but I didn't understand the difference in it.
Sure.
And I think a lot of people will struggle like that. Like we discussed, you know, people think urgent care.
Right.
You know, urgent care for everything. Where's the urgent? It seems to be, and I don't know when that model popped up. That seems to be huge in this day and age.
Right. Right.
You know, I know when I was a kid, it was going to yard, rub some dirt in it, and get back at it. Now it's urgent care
Right.
for everything. But you know, with you, they can just come in and see you.
Right. Right. So as I was saying, you know, think of urgent care, and I'm going to use this word. And for those who do own urgent cares, please don't get upset at me. But urgent cares are like the parasite of the system. They're feeding off the system because of its flaws. And let me explain. So because there are not enough PCPs to see their patients, the patients that either 1, don't have PCPs, 2, don't have insurance, or 3, can't afford the emergency room, eventually go to an urgent care. And they go to an urgent care, and they even use urgent cares as their primary care physician. Oh, I have thyroid disease. Oh, let me just go to urgent care and get your thyroid medicine. Well, no, that's something your PCP or primary care provider should be treating.
Yeah, I'd definitely be worried about going to
Right.
urgent care for that.
Right.
Because there's a lot that goes into that.
Urgent cares occupy this space that really should be occupied by the patient's primary care provider. Part of the problem is after 5 p.m., I probably can't get access to my primary care provider in the traditional model. Mm-hmm. However, with the direct primary care model, you can have access to your primary care doctor. You can have access to me as a member of my clinic, whether it's 6 o'clock on a Saturday or, 8 p.m. on a Sunday because your kid has a fever. I want you to call me. I want you to text me because I don't want you to go to an urgent care because that doctor doesn't know you. I know you. Why? Because you've visited me so many times before, and I know what medicines, what your allergies are. I know exactly what you need, and I know what has worked in the past.
Yes.
And so, once again, this model, as you said, returns that country doctor, that doctor who is willing to come by your house or who's willing to meet you at the clinic, at 6 o'clock on a Sunday evening.
Yeah, and until speaking a few minutes ago, I never made that connection. And then when you really think about it, it's like, well, what killed that originally?
Oh gosh.
Well, the insurance. It's become such a corporate system. It's not, there's a lot of people out there. It's not always about healing people anymore with most of those.
Right.
So with this return, which it's just such an awesome model to to give people that. I remember you said that about, losing your primary doctor, maybe the doctor you've been to for all those years. I told you before I had ear surgery. When General Motors changed their insurance at one point, we had to change our doctor. So I had to go to a new ear, nose, and throat doctor at, as a middle school age, not the one that had done the surgery and had seen me since I was 3.
Right.
Wasn't a big deal. Now when insurance switched, my parents took me back. He was livid because of some of the things the other doctor had done that he had not wanted done to my ear. He was like, why are, because he didn't want fluids in my ear. So they had washed my ear out to clean it. And I remember when they did it, I was like, listen, Dr. Lampros don't want you doing this. And Doc's like, yeah, well, I'm the doctor. I know better. And I remember when we went back, I told on him. I was like, yeah, my mom's to take me this other guy, washed my ear out. And he was like, Miss Boyer, can we talk? And I was like, oh, yeah, I had a long ride home. His mom was like, oh, you think it's cute? Get me in trouble, huh? I was like, just saying. But you lost that connection. And so now I was at a new doctor, didn't know me, didn't know my allergies, didn't know my ear.
Right.
Now that I've learned later in life, it was an odd procedure.
Sure.
The tumor broke the 3 little bones in the ear. So I have like 90% hearing loss in this ear.
Wow.
Not a big deal. Something I'm totally used to these days. But anytime, like I have a pre-done spiel anytime I go into a new physician for anything, because I wait, I let them check my ear, and they check this one. And then when they pop in this one, they're like, huh. And I'm like, so there's a hole in the eardrum. There's 3 bones. I like break it all down. I like get your notes out. So I always laugh. The original Roadhouse movie, he has his own like medical folder that he gives the emergency room nurse because he travels. And I've always laughed that I was like, I just want one of those for me to be like, here's my ear, here's a diagram, here's a doctor's notes.
Here's what's going on. Right.
Because I am at an age where that procedure I'm told is not done that way anymore, to where it's always, kind of re-educate the person. Or my dad's old doctor I used to go to in O'Fallon, who's retired and probably 10 years later than he needed to, he would always, every time I went in, there's something wrong with your ear. Yep. And I'd run him through it. He'd be like, I think I got another patient with that. Nope.
Nope.
It's me. You've got 2 with my name, but only me with the ear. I used to just get a giggle out of it because he was super old, but it was like $35 cash to go to him. And I told you, I only needed my eardrop. So I would deal. My dad just used to laugh because he's like, you like messing with him. I'm like, I'm not messing with him, but he's 80 and he doesn't know. But that is kind of ruined in this day and age. Where you don't have that. Or I talk to people all the time. They're going to a new doctor now. That's gone. And would you say, has the insurance system or kind of is what's kind of pushed that away?
Yeah. Well, so medical history, or the history of medicine in this country is kind of weird. Prior to the passing of Medicare, it's, as you said, physicians would visit their patients or their patients would visit them, and whether or not you had insurance wasn't really a big deal. You essentially just paid how you could. That's where the whole bring a chicken to the doctor came from.
That's what my brain just thought.
Right. Well, you just paid how you best knew how, and then you moved on with your life. Enter Medicare, which originally was supposed to be some type of a safety net for those who couldn't afford health insurance, mostly the elderly, which is why most times after 65 you're on Medicare.
Yes.
But with the Medicare came also Medicaid and also the residency program. And so they paid for residencies. So what ends up happening as hospitals start to realize how Medicare pays, hospitals started to dominate the residency programs. And, now to an extent, there's a benefit to that because the sickest patients come to hospitals. And so the residents were able to learn from the sickest patients. However, the drawback is hospitals got to direct how doctors were trained.
Yes.
And more importantly, they could finagle that insurance system in such a way that a lot of that Medicare funding came to them. And now what ends up happening now, a lot of hospitals, either hospitals or insurance companies, are buying up these smaller practices. Now, if you think about me, a solo practitioner, I couldn't afford the compliance that's required for many of these insurance companies.
Oh, I bet.
That compliance is expensive, it's time consuming, and it takes time away from my patients. So in order to avoid all that compliance that they burden me with, if I step outside that system and I'm essentially treating my patients the way they're supposed to be treated, then I don't have to worry about what the insurance wants me to do, what box they want me to check. Because checking those boxes means I'm not paying attention to you.
Yeah.
Does that make sense?
Oh, for sure.
And it gets frustrating mostly for the patients. And the other thing that it drives this numbers model where in your typical practice, this doctor has to see so many patients in order to pay himself, pay his staff, keep his overhead running, because the insurance is only going to pay so much for that procedure. Didn't matter how long you spent educating the patient. Didn't matter how many times you had to revisit that procedure. They're only going to pay so much for it.
Yes.
And so now I have to drive numbers. I have to see 20, 30 patients a day to keep my practice running. With the direct primary care model, I'm not paying, you're not paying me for how many times you see me. You pay me once a month and you see me as often as you need. Now, what ends up happening, I'm providing quality, not quantity.
Yes.
Because I can focus on you for as long as I need to without considering, oh man, I'm wasting all this time and I'm not going to be paid for it. Well, you've already paid me. You've already paid me that monthly fee, and that works out. And that's the very reason why you can call me on a Sunday or call me on a Saturday at 12, and then, it doesn't matter because you're my patient.
Yeah,
I'm on
for
call.
sure.
Right.
Well, and then you look at it too, and it's something I noticed with our business as they've grown. So now you got this doctor, you got to see 20, 30 a day because maybe they're not paying on X, Y, and Z.
Right.
Well, now they got to hire someone just to go in and focus on that billing.
Yes.
And then they grow more and they got hired. So we got to a point to where 90% of my wife's job, instead of helping me run the businesses and us running our household, was her just following up with people on money.
Right.
Money. And people are like, you guys are all about the money. It's like, no, we have to get paid. Her literal job 90% of the time was, when can we meet for a check? When can we do this? When can we get a deposit? And as we grew, I was like, oh, wow, I'm going to have to hire someone just to do that as we grow. Because then you got people who were offering, financing for paint jobs and stuff.
Right.
And I was like, absolutely not. I'm not adding another cog to this.
Another layer, yeah.
Because we can't raise the prices anymore. And I'm not going to go out on the job site and whip the guys to make them go faster. Like, there's nothing we can do. We can only produce this much at this rate.
Right.
Before it's like, okay, now we've got to make a jump from. So for us, it was like 8 to 10 employees, and then I needed to jump over 20.
Ooh.
I needed to double what we were doing for the profit side to then again
make sense.
Double.
Wow.
Because then you had to have, when we had 16 guys, I had me and Melissa bidding. I had an office manager and Casey doing networking and then overseeing them. And to go any bigger than that, I almost needed another person bidding. Because I needed to step out and just oversee everyone.
Right.
It was wild as I grew and learned. And that seems to be the same thing the doctors come into.
Sure.
They've got to do this and this. And now because I can't tell you how many times we've went in and then we'll get a bill on something. They'll be like, well, they declined it. We'll send it through again because the insurance was good. And then they send it through. And my brain as a business owner goes, wow, there's someone just sitting in office doing that all day.
Right.
That's all they're doing, because I know I'm not the only one that had an issue that day.
Right.
They're literally sitting and doing this all the time.
Yes.
With no guarantee on getting paid from them or the person.
Right.
It's wild, because when I tell people we're just sticking with 8 employees, I like the size we're at. They're like, well, but you could. I could, but like, I talked to someone who had a pest control company. He said after he got past like 12 or 15 pest control guys, until he hit 35, I think it was, he goes, never noticed a difference in my take home. He said we had to get that big. He said, and then by then my headaches were so big. He had stories of because each employee got a truck. Luckily of mine, only the foreman get one.
Right.
But, having to go pick trucks up at a bar, pick trucks up at a gas station. Like, he had all these stories about, we were at one of my students' birthdays parties, and it was his grandfather. And I just was picking his brain on it. 'Cause I'm like, did you notice once you got paid? He's like, oh yeah, 10 to 30. That's wild. I never would have thought that doctors would be in that same spot.
Right.
But it makes complete sense.
Well, it does. And if you understand how this works, so in my current system, I don't have a biller.
Yeah.
Because I don't bill. My patients just understand that they're paying to have access to a physician at all times of the day. And that's what they pay for. They don't pay for the visit. They don't pay for, the phone call. They don't pay for the email or the text. They pay to have access to me. Outside of that, I'm their physician.
Yeah.
Currently, though, because it's a fee-for-service model, in other words, I looked down your throat, I looked in your ears, and I gave you some medicine. Now I'm treating you for, I don't know, otitis media, ear infection. So they're paying me for an ear infection. They're not paying me for the education that I told you.
Yes.
They're not paying me any of that stuff. But yes, I need a biller to go chase that funds down. Here's the issue. The issue is it takes about 3 months-ish for that insurance company to turn around and pay me.
For sure.
Now, how many businesses can work 3 months without getting that money coming in?
Oh, it's
we got
ridiculous.
money going out because I have to pay my workers. I have to pay, myself. I have to pay the overhead. So for 3 months, I'm essentially digging into either my savings or the savings for the medical practice. And so understanding that the turnaround is rough on practices. And recently, I don't know if you follow this, but a subsidiary of United Healthcare was hacked.
Oh.
And so everything got shut down. Well, for however long, everything got shut down. Guess who wasn't getting paid? Doctors, clinics, pharmacies. So patients were out of their medicines. They couldn't have access to their doctors. And all this was going on. And then you know what United Healthcare turned around and do? They went to these struggling practices and if saying, oh, we're sorry, here's something to buffer you and keep you going, they turn around and offer to buy them.
Huh.
Right.
That doesn't seem shady at all.
Oh, not at all.
No, that's
and
crazy.
So that's part of the, that's part of the weirdness of taking advantage of sick people for profit.
Yes.
And let me explain. When you're sick, Matt, you don't have time to read a contract and negotiate business and look and compare prices.
No, you just
when
wanna
you're
get
sick,
better.
you just want to get better.
Yeah.
And this is why this is a weird spot for healthcare, because we're quick to say, oh, healthcare should be a business, except the folks who are supposed to be benefiting from this business are not in the right place to really conduct business. When you're having a heart attack, you're not going to compare prices.
No.
When you're having a stroke, you're not going to compare prices.
No.
When you're sick and feeling crappy, you don't want to read a contract.
No, I can't tell you how many times I've said, just give me medicine. I don't care.
Right.
Like, no, seriously, like I those words have rolled off my tongue before.
Right. And that is why healthcare cannot be the business in the traditional sense that we conduct business.
Yeah.
When I go to Walmart, I can look at multiple different things and say, okay, I want, this toilet paper as opposed to this toilet paper, because I'm comparing prices, I'm comparing comfort. But when I'm sick, I don't have that luxury.
No, makes sense.
And that is why healthcare just cannot be the way it is in this country. And so part of what physicians are doing in protest is this direct primary care model.
It's awesome.
Because it works.
Well, that's like with us with the builders. I turned down 5 builders. It's been about a month and a half ago now. I've gotten away from all builder work. And I left one that I was with for 7 years. He's like, hey, what's going on, man? You mad? I was like, no, you're doing really well, man, but I can't do net 30.
Right.
Because net 30 turns into 45 days, whatever. There was points around Christmas time. I was stretched out $108,000. As a small business, that was brutal. I made sure my crews got paid, but guess what? The plates expired on my truck.
Yeah.
I had to eat it. So I realized that, and it really and truthfully, at the end of the day, there's very little protection to make sure I get that.
Right.
So we went back to, like I said, I'm just running 8 guys. We're doing repaint work for customers where they pay for the service, and we finish the service that we provided and they pay.
Right.
Because people don't think about that. 3 months, when you said 3 months, that about gave me a heart attack. Like, that's a lot of time to be waiting on money.
It is.
And people think, well, you're in business, you should be able to handle it. It's like, okay, so, I understand the banking system. I understand how everything is set up. And so I should go get a $500,000 line of credit that they could take away at any time.
Right.
Because no one believes me on this. The gentleman I told you with the pest control company and discussed it, they cut his in half on him overnight. When 2009 hit, they said, you know what? You now have 70 grand or whatever it was. And luckily he was in a spot to say, here's your check, you're good.
Right.
A lot of businesses max those line of credits out, make the payment on it. If the bank calls it in that next week, they're up a creek. Well, what do? They take whatever you put up to get that line of credit. Most of the time it's your business.
Right.
A lot of people put their houses up. So I should say my house is paid for and I get a $400,000 line of credit. Then I'm hoping when I go to paint for all these different clients, they're going to pay me.
Right.
Well, in 2007, 8, I was in construction. I watched a lot of companies that were working for a specific builder that was huge. Well, he went under. Guess what? Those companies don't exist anymore. And they had 50, 30, whatever employees all over the place.
And who are you going to sue?
What are you going to do? They're gone. The two big ones, I mean, they've never reestablished. The guy is still not worth a dime. And it always made me very concerned. So like when COVID hit, I was very worried about, because we were working, I was worried about the offices that owed me money shutting down. If they closed because their employees can't come in, whatever happened, it was all in the beginning when everything was really up in the air. I was like, what do I do? Well, I had a gentleman out of California wanted a classic car I had. I sold it. He wired me the money. He came with a little, it was hilarious. This little dude showed up with the ricketiest 18-wheeler car hauler I've ever seen. He backed it down my street and we ramped the car up on it. It was the wildest thing I've ever been. He didn't speak any English. Gentleman was coming from LA.
Right.
This car and brakes is all we said. And I was like, no, and I'll help. And we got it loaded up. It was the wildest thing. But I sold it, put the money in the bank, and just sat there just in case, because I never wanted to look an employee in the eye and say, I don't got it.
Right.
But that's it. And basically that's what the medical professions are doing. You know, if they're waiting 90 days, that's 90 days. Woo, whoo. That is a lot of time. That just makes me.
Well, and that's if they approve your billing.
If they approve it. No, for sure.
Right.
Yes.
If they don't
That's a
approve
big
it,
if.
now your biller has to go back in and the doctor has to get on the phone and do what is called a peer-to-peer review, which is time nobody's paying the doctor for.
Well, yeah, but if you're seeing 200 clients a week, how many of those are you going to have to do on top of seeing your clients? That just adds, it's like stacking cups. Just
right.
That's crazy.
So you can see how, the insurance model adds burden to the system. And because it adds burden to the system, physicians are wising up to that, and they just don't want to be a part of that, burden anymore. They don't want to be under that burden, I should say. So for me, that's part of my personal reason why I'm outside the insurance system. And I don't mean to get political, but there are better ways to do it, and many other countries in a similar spot as the United States have done it better. But currently, as we are, I think this is one of the best way to provide primary care to patients, especially those in need, without having all this animosity, especially with the insurance company. And I'm you know what's crazy, Matt? Most of my patients currently have insurance.
Yeah, I bet.
Because they like the access. I had a patient the other day. She said, "Hey, can I come in? I'm feeling sick." And she came in, looked at her, and I was able to diagnose what was going on and treat her and give her all her medicines right there. And she's like, "Oh my gosh, I could have never done this with my PCP."
Oh, it'd have been an all-day ordeal.
Right.
Probably.
Well,
if
more
he could've
importantly,
gotten in that day.
right,
Yes,
exactly.
if,
She wouldn't
yes.
have gotten in that day. Because he's already booked up.
Yes.
He's probably booked up 2 or 3 weeks in advance.
For sure.
Well, if you have strep throat, are you going to wait until that turns into scarlet fever
Yeah,
before
yeah.
you get treated? No, you have to go to urgent care. And then you see how the urgent cares
For sure.
stay in business, because
There
you
you go.
can't get to see your PCP. So
Yeah.
now you have to go to an urgent care. And you go to the urgent care and they looked at you and they give you what you need and they send you on your way. But they never consider you their patient, because guess what? They're in urgent care.
No.
And so I am off the school of thought that direct primary care model is growing. There's evidence for that. It's not meant to be something big or conglomerate, because then we're kind of turning into the very thing we're trying not to be in the first place. But I find that when it's a small clinic, it's run by a couple of providers, 1, 2, maybe 3, and patients are satisfied. It runs beautifully. When it starts to grow and become a large conglomerate, the waste in the system tends to eat up the profit.
Well, and I think that's part of any business that I've always, when I've studied bigger business, I've always been so amazed. It seems like there's definitely a big gap there of, like we got to a size point where I could have had someone as a writing boss.
Wow.
Did I really need them 40 hours a week as a writing boss? No, it's about a 15-hour a week job.
Right.
But they needed to do a little bit each day. So what do? I'd be a writing boss in the morning and then go back, no, you end up putting someone in that position that's then getting paid when they're really not providing that much value to the owner.
Right.
Which most customers are not concerned with. They're just worried about quality. But then guess what? Prices go up, because now the owner has to bring in more money to pay this person. Because as we got size on me, I had people reach out that were that position for other companies that were like mine. And, we'd kind of discuss what they made. They were salary 35 an hour, basically, is what it boiled down to. And the guys are like, I do your job. And I'm like, well, you're not doing my job because you're not going to bid and be the writing boss and
Right.
quality inspect and go to networking.
Right.
Like, I do all that in a 30-hour week. You're not going to do all that. You're just going to go walk the jobs. Okay. So you're going to just go hang out on the job sites is what it's going to be. And I'm going to pay you. And there was a big gap there to get over. And it was like, well, stay this size and do that. So what led you as you kind of went through, you kind of took us through a little list there of everything
Sure.
you've done. Like what really kind of drew you back then to this model?
Sure. So while in med school, I went to an AFP conference. AFP stands for American Academy of Family Physicians. They have a conference every year in Kansas City, Missouri. And on my first visit to one of those conferences, really big conference, I mean, medical students from all over the country who are interested in family medicine go to this conference. And so I went to this conference, and one of the speakers was talking about direct primary care. And I'm like, what is this?
Yeah. Oh, yeah.
But let me go listen.
You're out of med school,
Right.
so you're
Well,
probably in the thought
Well,
process.
I was in medical
Med
school.
Okay.
So I already knew that I didn't like insurance by
Yeah.
then, because I saw what needed to be done through the insurance model, because you're shadowing physicians during med school. So you see, kind of all that they have to do. And so when he started talking about this model of, my patients see me all the time. They just pay a monthly fee, and they just see me same day or next day. And I'm like, wow. Okay, well, what's your panel looking like? Because the average family provider who takes insurance has a patient panel of anywhere between 2,000 to 3,000 patients. Well, that's a lot of patients, right? That's a lot of people to keep track of.
To remember.
Right. And then he's like, my patient panel is, 800, which is what? Not even a third of a 3,000 patient panel. And 800 is really, you're maxing out at 800.
Oh, I bet. Yeah.
So I was like, wow. So to me, my patient panel was small. I had better satisfaction because his days were done at 5, and he didn't have to catch up on charts and do all these other extra things that most physicians are doing once they get home.
Oh, for
Their
sure.
day's not done. They're still writing charts because, they couldn't really spend time writing charts and seeing their patients at the same time. And so I fell in love with what he had to say right there. So when I got back to med school, my third year, I was telling everybody, I'm going to practice direct primary care. And of course, everybody's skeptical because they weren't at the meeting, and they're like, whatever, bro, how that's not going to work. But fast forward, we are where we are now, and direct primary care is growing. Most people who live, close to a large metropolitan area or within 20 miles of a direct primary care provider. And there are websites that are dedicated to finding a direct primary care provider, which is what led me to Lincoln County. Because when I knew I wanted to start a practice, and I knew I wanted to be direct primary care, but I also didn't want to compete with other direct primary care providers in the area. So living in Wentzville, and there was one in O'Fallon, I said, okay, let me look north. Sure enough, Troy, which is the seat of Lincoln County, has no direct primary care providers in all of Lincoln County. And this was a great opportunity for me to introduce Lincoln County to the direct primary care model. Now, the good thing about Lincoln County, with Toyota being there and GM just being down the road, a lot of the workers there, up to 80% of Lincoln County residents have some type of insurance. Now, that also includes Medicaid, but still. And so I also understood that with 80% of residents having insurance, they may not be interested in direct primary care model off the bat. But what I find, Matt, is that once somebody comes in and they utilize my services and they see the ease, they see what it takes, and they see the fact that I'm spending time with them, and I'm not rushing them, and there's not 50 other people in the waiting room, and it's not a 2-hour wait for a 5-minute visit. They just love it. And they're willing to pay that little extra above what they already pay for their insurance to come see me as often as they need to.
Well, and you even say pay the little extra above, but as an employer, Casey reached out, we were getting quotes for our employees after I kind of find out the model. It's way cheaper for us and for the employees. Because like I said, so my guys, when we cut payroll every month, we send this much in for health insurance, this much comes out of their checks. Then if they go to urgent care, $50 every time they go in, plus they get a bill.
Right.
Before I ran everything by Casey, even I talked to my office manager for Taekwondo School, Stacy,
Sure.
her husband paints for me. I said, let me run this past you. What do you think? And she goes, I've actually been thinking about going up there. She goes, we go to urgent care a lot with the kids. This may be something. I'm like, well, here's what I'm thinking of doing. And so we played with all the numbers and we looked at it from her side of what do they pay when they go?
Right.
What do I pay on my side? And we did all the numbers and I'm like, this is ridiculous. The money that goes out.
Sure.
And what do we get back? I said, now, if I'm paying all this for you guys to have insurance. So when I was a kid, my dad worked at General Motors. We never paid a dime on anything.
Right.
He had what he always called it the Cadillac plan or whatever,
Nice.
but 100%. Never paid for anything.
Good.
But this was the 80s. This was also, my father was a labor relations representative for General
Right.
Motors. My mom never had to work.
Right.
My dad made enough money to support. Totally different era.
And insurance companies weren't as greedy. So let's
Yes, it
let's
was a
just be
different
frank.
era.
Yeah.
Different era. But nowadays, I pay ridiculous amounts, and my employees still don't get taken care of.
Right.
And that's my issue. If I'm going to pay the money and we're going to charge the clients accordingly for us to afford this
Sure.
for our employees, I want them to get value out of it.
Right.
I want them to be able to run up the street. One of my guys has a 1-year-old. I want him, and he lives close to Highway W at 47. He
Sure.
lives, 5 to 8 minutes from you probably.
Right.
To me, I think it's really cool to be able to provide that for him because he can just run right up the street.
Right.
Little boy's taken care of. He's good. They're new parents. They're really nervous
Right.
about that stuff.
Which a lot of it is anxiety, right?
Yes,
As a new
yes,
parent.
yes,
But hey, peace of mind is
he had
so
to leave
much-
work the other day because they met in O'Fallon. He was on job site in O'Fallon. The two of them both brand new parents, so they both went to take the doctor together. God bless them. They
Right.
both went together. It's
Right,
awesome.
right.
People do that, but it's anxiety. It's that new parent thing.
Right.
Having something like this in the community, I think, as people understand it, and kudos to you. And I'm not just saying this because you're on the podcast, because anyone will tell you I'm not a suck up. You go to all the meetings. You're a part of all the groups. You've gotten your name out there. I watch so many people open businesses and they don't do that. You're going out, you're speaking at Rotary, and you're at all of them. You make it to way more stuff than I do. Thank goodness I got Casey, because
Right.
I keep saying this week, I'm like, go to Rotary Wednesday. And
Right.
My
She's a superstar.
my
though,
book
Casey is.
published. Oh, she kills it. My book publisher guy called me. He's like, hey, can you meet 1:00 on Wednesday? And I'm like, yeah, I might be a few minutes late because I'm going to Rotary this week. But you go to all the meetings and you're getting out there to lay the groundwork to educate them.
Sure, sure.
Now, is that because, would you, as you grow, is this a model where you'll, probably bring someone else in? Because I would say there's probably a cap where you're going to say,
Right.
okay, this is the amount of clients I can handle.
Sure, sure. So absolutely. My goal and hope is, as I grow, somewhere between 200 and 400 patients, I should be able to bring on another provider. But first of all, you brought up so many good points. Being a direct primary care provider is such a comfort for new parents,
Oh, for sure.
because you get that text at 8:00. Hey, little Johnny has this on his nose or face or tummy. What do you think? A lot of times it's benign, but
Yes.
sometimes it's not.
Yes.
And, I want to be able to say, oh, don't worry about it. It's, nothing you need to worry about, etc. But you also brought up this whole idea of urgent care, or people who are using that urgent care facility so often. Part of my goal is to keep my patients out of an urgent care.
Yeah.
The only way as a patient you should be going to the urgent care is if you're in New York City and I'm here in Missouri. And for some reason, whatever you have needs to be seen.
For sure.
Because there are times when my patients are in another state and they give me a call like, doc, blah, 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 blah. I'm like, okay, what's going on? Tell me about it.
Yeah.
Tell you what, I'll send you something to a pharmacy. See me on Monday, or see me the next time
For
you're
sure.
in town. And number one, the fact that they can get a hold of me is so much peace of mind, because it gives them, it puts them at ease so they can go on that trip. Even this Christmas, I had a family come in. Sure enough, their kid had strep, fever of 103, and they're about to go on vacation for Christmas. Swabbed, she did have strep, antibiotics right then and there, whatever else she needed for the treatment, and they could go on their trip, get treated, antibiotic, fever went away, and they enjoyed their Christmas. So these are tiny little victories that I put under my belt
Oh, yeah,
every
definitely.
day. And you know, you talked about going to these meetings. It needs to be done. I
Yes.
can't say I want to be a part of the community, but don't be a part of the community. It's the reason why I coach TYSA, which is Troy Youth Soccer Association. I'm a coach there because, once again, I can't say I'm a part of the community, but isn't active in the community. And so part of saying, look, I am a part of this community and I want to be involved in this community and I want you to see me as such, is to be involved, is to be visible, is for people to say, oh, there's Dr. Hannam. He owns a clinic. And what I'm finding, Matt, is when people can't get into their PCP, even though they have insurance, even though I spoke to them when I just moved into Lincoln County, like, oh, okay, well, good model, you know, we'll talk later.
Yeah.
Hey, can
They're
you
calling
get
you.
such and such in? Blah, blah, blah. And sure enough, and so you're what I'm finding is that they're starting to think of me or think of House of Health when all the other options are failing. And while I don't want to be last choice, when they come and get the service, they're like, huh, not only was this easy, it was cheap. I felt like I was listened to. I felt like I was treated with care and compassion. Now he's my first choice.
Well, and like you said, you're doing the things to be a part of the community. When we first moved the Taekwondo school to Troy, we didn't live in Troy. And we still had our apartment in O'Fallon. We hadn't made the decision because I did the school in Wentzville. I opened a second one in Troy and I moved everything to Troy. And I told Casey, I was like, we were going to buy a house. Then I opened Boyer Painting with I had saved about $50,000, put a big down payment on a house. And I texted her one day at lunch at work. I'm like, hey, can I open my own painting company? I'm tired of this crap. And for God seen it fit, she let me do it.
Right.
I tell everybody all the time, like, she said no to that text, we'd be in a different spot. So we stayed in the apartment for 2 more years while building the painting company up to buy a house. But it bothered me being in Lincoln County, being a part of so much and not living there because I felt like an imposter. I know there was a bad snowstorm and the kids were all stuck at school.
Sure.
I remember telling Casey, I'm like, if I lived there, I could drive up, except 4-wheel drive truck. I could drive up to the schools and do Taekwondo with them because they were like teachers were teaching guitar, like they're trying anything they could. I sent more pizzas as Boyer came. I contacted Rachel South at the time. I said, hey, I'm in O'Fallon. I can't do nothing. If I buy a bunch of pizza, could you guys get them to the kids so they can have dinner? And she goes, you buy them, I'll make sure it happens. And Rachel, I don't remember who all did it, but they all made sure the pizzas got there. But I remember being upset. I was like, if I lived there, I could go up there.
Right.
And all it was is we had our apartment. It worked. We hadn't moved yet. When we did move to Lincoln County, I really was happy because now I felt truly a part of the community.
Sure.
And I thought being a business, like with the martial arts school, I grew it to a size at one point that I had all my instructors teaching. I was supervising class there every night. I had to do that because they had to learn to teach.
Right.
It was torture. I hate it. I'd sit at the desk, test Casey all night. I'm like, this sucks. I hate this. Because I like teaching. I like working with the kids. I want to work with the little 4-year-olds. I want to do, I don't want that. I don't ever want to make that into a chain.
Right.
Now, if my children grow up and want their own school, then we'll branch out.
Right.
Or if one of my instructors, we were talking about Kendall before the start. If Kendall said, you know what, I want a martial arts school, boom, we'd open a school.
Nice.
Hands down. But me, I like working with everyone. And I get that with you. You want to learn and know your patients and their names and their hobbies. And you want to know that stuff. I want to know all the kids. I go into all the elementary schools and do career day, and I see so many kids as they've grown up now. I really like that, and that part of the community is so important. And I see businesses open up, and it may work in other areas, but in Lincoln County, you've got to be a part.
Oh yeah. And so coming from Cassville, what I get in Troy and Lincoln County is that small town feel. Yeah, we're only 4 to 5 minutes from St. Louis, but you come into Troy and you get that small town feel, which means people are more likely to do business with you and deal with you once they know what you're about and who you are. And I do want to make a caveat here.
Yeah, go for
As a direct primary care provider, I don't see my patients if they're hospitalized.
Oh, okay.
And I do want to make that difference because there are times when I think insurance is important, especially in the case of hospitalization, car accidents, other types of trauma, strokes, heart attacks. You need a hospital for that issue. You don't need a hospital for, oh, I have strep throat. You don't need a hospital for, hey doc, you help me manage my migraine. I have a urinary infection. I want to manage my thyroid disease, my diabetes, my hypertension, and and that's what the PCP is for.
Yes.
It's to manage
things
those
for both.
diseases.
Yes.
Yeah, and so the direct primary care model is a model for primary care, and the issue is, you talked about you being a small business, that pressure of providing insurance for your patients can be such a financial burden on small businesses. And I do think that the direct primary care model is a good, it's a good way to build up to that, because a lot of businesses or small businesses lose their good workers. Why? Because they can't provide those benefits that they can get at some of those larger companies. And so a direct primary care, using a direct primary care model as a business, and I do have employer discounts, as you're well aware, means you can provide your employees with a medical benefit and still retain them.
Yes.
And so, because if they're using urgent care, they're going to use me.
Yes.
Most times they're not going to the hospital. They don't need to go to the hospital. They need to come and see a PCP. Yes. They need someone that they can call, text, or even just reach. Hey, doc, I'm having a fever. Hey, doc, I'm having a cough. Hey, doc, whatever the case may be. Now I'm treating them. You're keeping an employee, and this other business who just happens to be slightly bigger is not stealing your really good workers. Because you're providing them.
And as a business model, for me, I pride myself with everything our businesses do for the community. It's a pride thing for me. It's a great marketing thing, but it's a pride thing. But I pride myself on being able to offer that stuff to the employees. But it's also, if they're healthy and they're doing well, they're at work, they're happy,
yes, sir.
My job's better.
Yes, sir.
If they're going into an urgent care, getting, I can't tell you how many times one of them's went in for something and then had 2 days later had to go back, for something else because it wasn't that, where it could have been a phone call.
Mm-hmm.
They could have went up instead of running up there at a certain time. Now they're waiting maybe to get into their doctor. Hey man, I need 2 days off because I can't get into my doctor till next Thursday, whatever the case may be. It's an investment in my own business, taking care of them.
Yes, it is.
And that was one of my big upsets with the insurance is I wanted two things were upset with the insurance. One, how many people did not want it, which blew me away. How many guys that in the trades, their wife has good insurance, or they just don't go. One or the other. Or a lot of guys.
Part of their paycheck that they don't want.
Yes, it is. And I completely get it. I was, I completely get that totally. But also the fact that it's making that investment, that they're healthy and I'm able to provide something. And what I like about it is, when we got the pricing back from you, as an employer, I'm only providing health insurance for the employee.
Right.
They pay to put their family on.
Sure.
With this, I could take care of everyone in the house.
Right.
And when I told that to the guys, they were like, oh, they're like, huh, that's really interesting.
Right.
And I was like, yeah, now for one in general's got 3 stepkids. I'm like,
Sure.
this takes care of everybody in the house. You're not running them up because, they're on probably Medicaid or something.
Sure.
The kids through their biological, you could just go up here and get them, take care of where you all go. And he was like, do you realize because they've got, the age groups are pretty wide on the 3 kids to where it's always a different doctor.
Right.
He's like, and he lives at the end of Main Street. So he lives just so close to you.
Right.
He thought that was great. He's like, man, that'd make my life so much better. And that's what I liked. I wanted to be able to add that to him, not only for myself and my family, because my son's just like, literally, I can't tell you, because he came in to see you earlier this year. I've been on job sites, and Casey will tell you this. We are the same human. I was on a job site one day and I was like sweating, I was painting, and I was like, whoo. And he was little. He'd have been 3 because it was before. I feel like I wasn't on my own yet, but I might have been on my own.
Right.
And I was sweating and I realized all the windows were open and it was a nice day out. And I was like, I'm sick. I was like, just felt my throat, probably got strep.
Right.
Feel like crap. Within 15 minutes, she's like, hey, just want to let you know your son's got a fever. That has happened. I bet 10, 15 times.
Y'all are sharing stuff with each
other.
And
if one of us goes, man, I'm not feeling good, Casey's like, great, 2 down.
Right.
2 down. And I'm like, it ain't 2 down. Within a day, the other one, if one of us doesn't feel good and the other one doesn't not feel good, it's weird.
Sure.
Even we'll like look at each other. I'll be like, What'd you do?
Right.
What'd you do different?
What'd you give me? Right.
Yeah. What'd you do? Because I don't feel good. You're good because we're always sick together.
Oh, that's
and
crazy.
we're both big babies. So Casey
Yeah.
always gets double trouble. But
Right.
it's one of those that we always get sick in a pair. So boom, we can both come up there.
Yeah,
Like it's
exactly.
not all right. Well, now we gotta make him this appointment here. I gotta take off work. I gotta do this, and then now I'm over here. So now I gotta do this, and then now one of us has to go get prescribed.
Right.
Like it to be honest, it makes so much common sense that it probably scares people.
Right.
'Cause it
Well,
just-
and that's part of it. It almost too good to be true. A lot of people are skeptical, but it sounds too good to be true. And part of it is we've kind of fed this lie from, oh, you got to go see this doctor for this. You got to go see this doctor for this. You got to go see this doctor for this. Or you got to go to urgent care. And then this random guy comes along and be like, how about you just see one doctor for most of that stuff and then only go to a specialist if you need it? I'm like, what? No,
that's not what they taught us.
Right.
No, that's not.
We don't do that.
Yeah. And that's something I had an old instructor of mine, Vern, and everything Vern did. We actually have a caricature in the school of it. It's this elephant I named Big Vern, just to keep Vern alive.
Right.
Vern always used to tell me Vern always told me keep it simple, stupid, the kids program.
Right.
And then I had a boss, Kevin, who might listen to the podcast, was my district manager. And whenever I'd have to tell him something, he'd be like, tell it to me like I'm stupid.
Right.
And I used to be like, but you're not stupid. He goes, no, I want you to tell it to me in such plain details that if I was a complete idiot,
That's right.
I could get it.
Yep.
This seems to follow that model of it's just simple and it just makes sense.
Right.
And that's how I like to keep things. There's so many things I could do with the businesses where I watch business owners overcomplicate things and make it. And I did it with the painting company. I did it with the academy at one point. I did all these things, had this creative scheduling, all this stuff. And it took 3 months and I tanked the school because I actually offered too much. One of the parents at the school I'm still really good friends with, he was he was a pharmaceutical rep, but it was surgical equipment.
Right. Okay.
Very smart guy. And we discussed, I was like, dude, what did I do wrong? I was like, we offered all the classes. We had breaks in between the classes for the for the leadership kids. I had high top tables for them to do homework. I had all this stuff. He goes, this is something we do for years. And you made it so accessible that people were here every night and it burned them out. And that's what we figured is we had to make it more of a trickle. We had to keep it simple, keep it work. And then the ones that were really into it could then come all the time.
Right.
Like that's kind of how we have it now, where we've got the front desk, they can do their homework, but we took the classes and kind of had to protect everyone from themselves.
Sure.
When I allowed them to come as much as they wanted, people would overdo it and then quit.
Right.
Bad business model for me. And also it was burning kids out instead of them really learning what they wanted.
Which means the next year when mama asks, hey, you want to stay in Taekwondo with them? I'm like, oh no, I want to do something else. Yeah.
Exactly. And when we cut it back, you can only come twice a week. We got this and this. Now it just massively changed everything at the school. With what you're doing, you're taking something that's super scary and complicated, like the healthcare system, and this kid goes this one, and you're taking it back to that country doctor, that one doctor that comes in and takes care. It, like I said, it's so common sense and so simple, it's scary.
Sure. And I think my patients, when they come in, it's the same. I explain the pricing schedule and how things work. They pay a one-time fee. They see me as often as they need. They call as often as they need. They text as often as they need. And what I find, Matt, and you think people are like, oh my God, patients are going to abuse that. They're going to be calling you at 10 o'clock at night. I still have not had one patient that called me at 10 o'clock at night yet.
Nice, yeah.
And if they do text me that late at night, it's often because it's somewhat urgent. And I probably need to
People
address
aren't
it.
sitting around going, you've got
Let me call my doctor. Right.
You're going to have that one random person. I know people, I've met people like that in my life, but that's not
the average person. No. Right. Most people are, they just want to feel better. They're not coming in just to get their doctor. They want to feel better. And so I love it's, you talk about the simplicity of it all. It's almost too simple. It's too good to be true. People come in, they love it, and they stay.
Yes.
There are not many people who says, oh, I hate this.
Well, every time
and if you don't believe me, you can look at my,
Yeah.
But then there's that.
Yeah.
My goal is I'm not trying to upcharge you because I hate being upcharged. Yeah. So why am I going to upcharge you?
And that's how I do Taekwondo school. It's this much a month. And people are like, if they've signed up at other corporate schools in larger areas, they'll be like, I'm like, nope, it's
It's just that.
Well, for years it was $99 a month. Like just $99 a month. They're like,
Right.
well, but what if we want to come on a Tuesday? Still $99 a month. But what if we sign up on a Monday? Still $99 a month. What if we want a T-shirt? When you buy a T-shirt, $25. But I don't have to pay an extra because I'm part of the T-shirt program. No, is someone doing that? Yes. Holy crap. Okay.
Oh, no.
I had one lady show me where she had like a $25 processing fee on her enrollment, and I was like, I shook my head. But there's a lot of business models that teach it that way.
Sure,
And I've got friends
sure.
that own those schools, and good for them. That's how they want to do it. And it hurt me at different points in my career, but I've always just kept it simple. And people are like, well, but I'm like, listen, this is what it is. This is when, like, even when I broke all my classes down by age and ranks, and I had to, as I learned more about the human brain, I just couldn't do it. Anyone shows up
Right.
whenever. It just doesn't work. We don't learn the same. And I had to do it. It killed me because I'm like, now I'm complicating my schedule.
Right.
I've always told everyone I love what I do, but I don't want to make it extra hard.
Right.
So this is how much it is. This is when you pay. You bill monthly. Because a lot of people are like, well, you should have an upgrade program and I'm like, and where they lost me on the upgrade, a guy pitched me on the upgrades. He goes, if they join the upgrades, they get the black uniform and that testing, they can earn patches and all this. I'm like, that's great. It's like, what about the kid that didn't get the upgrade? Well, they're just in a white uniform in the back.
See?
So I'm shaming them because their parents would do it.
Essentially, you're making a classes system, right? You got the rich kids who can
Yeah.
afford it and the
I
ones who
looked at him,
can't.
I'm like, so I'm going to shame. And I thought
Don't
back,
do that.
well, I've been at Taekwondo 15 years now. Some of my best students definitely were not the ones that could afford it.
Right. Exactly.
And some of the greatest kids that have come through my school, whether they're still with me or not, I have got kids that still come up and hug me at the fair that I mean, I've got kids I've dealt with for 15 years now. They weren't the best. They weren't the most coordinated, and they definitely didn't have the money to do it.
Right.
What the thought of doing a class system and shunning those
Yeah.
kids in the back in a white
Yeah.
gi.
I mean, they already.
I
being
wanted to
shunned as
ask,
it is, right?
do they have to pay me to talk to me? Like, I remember when they were telling me it, I'm like, well, this is cool. I get what you're doing. And I told them, I was like, no, thanks. And they said, what? I was like, just going to do it my way. And
Right.
if it works, cool. If it doesn't, I'll paint. Because at the time I was still a full-time painter. I was like, I'll just paint.
Right.
And, do a garage dojo or something where I could teach out. Because I've done martial arts now for going on 32 years this July.
Sure.
It's just me. During COVID, when we had to do stuff virtually, I realized how much it just was me. I have to do it. Like I sat down with Casey at the table. I'm like, if this goes on too long, I'm really going to have to seek help because I didn't realize how much that dojo was for me, not just them.
Right.
I was like, this is something. I've done it every day of my life. I've went up to Taekwondo school and taught every day of my life since I was 14.
Nice.
That's a hard habit to break. And when I was just doing a virtual video, I'm like, hey guys, we're going to just log in tonight. You can watch me kick the bag. And I was like, we'll do a bag workout. Everybody's like, you're losing it, aren't you? I was like, yep, I am absolutely losing it. But I just keep it simple. And
Yes.
that's what I think you've done. So as we wrap up here, how can people find you, find your clinic, find your services? I'm getting better at having this.
Thank you for asking. Yeah. So they can visit my website and learn about what I offer at myhouseofhealth.net.
Okay.
Also, I'm on Facebook at Hannam House of Health because there's a lot of House of Health on
Yep,
Facebook.
I
So
bet.
it's Hannam House of Health on Facebook. I also do a little TikTok. It's not the best, but you can look up Dr. Dr. the number 2 and Go Box or Hannam House of Health on TikTok, and or just 425 East Cherry Street in Troy, Missouri, and come by the clinic. Of course, phone number is 636-622-9050. And look, we're just regular folks, and I want people to feel better.
That's awesome. Well, I appreciate you coming on today. Thank you guys for watching. I hope you learned a lot today. That is the goal of the Lincoln County podcast, is bring you guys long form information on the people in our community that are serving this community. So like, share, and check out our sponsors. They mean the world to us. So thank you guys today.